Hello, dear colleague. I am honored to participate in the Congress of Berlin this year. My presentation discusses about the metagenomic approach to the renal failure in children. I am medical microbiology. I study in University of Algiers 1, and I am a professor and head chef service in Central Laboratory of South of Algiers, Urgra, University of Kasdi. My reference is the microbiology study of microorganism infection research in Algeria. The box office is edited by me, Baral Munir, and other like SAMIC, SIBC, Java, and the first International Congress of Pediatric and Global Scientific and other. Infection urolithiasis is a significant cause of urinary stone formation in daily medical practice, accounting for 10 and 50% of cases. It is likely underestimated, as recent findings show its involvement in other types of complex lithiasis are mixed with the microorganisms. Effectively, management requires understanding the specific evolution of the microorganisms involved. How to demonstrate a metagenomic approach can help identify difficulty to detect some microorganisms in pediatric patients or in other with infection urgencies, with complicated infection leading to better clinical outcome and prevent the complication, fatal complication like urosepsis and failure organism, notably renal failure. I am happy to discuss with you the method and the case study. I will study an act of 5-year-old girl originated in Tarf in the south of Algiers, with a co-singularist relative, admitted at the Hospital University of Mohammed Zain Naqash in 2028 for right pelvic lithiasis with urosepsis and have fever, 40, weakness, and associated infection with high blood cell and high blood white cell. He received an antibiotic like imipenem and antifungal. She was programmed for flexible urethoscopy by laser in collaboration with Professor Tariq Lunisi and Barabah, the urologist, the endourologist. The clinical situation was the clinical situation in this girl children. Despite being the antibiotic treatment, her condition worsened, leading to multiple kidney abscess and right renal insufficiency. My method, the conventional method, performed a culture of fragment calculus after surgery, flexible ortho-specific logic with laser pediatric, with method STYMI method, and decide to explore or investigate the cause of worsening condition of the sample of intraoperative and per-operation urine sample conducted in the microgen about direct sample to metagenomic analysis. 16 as Elena, V3, V4 PCR. This slide after explain the flow chart of processing sample metagenomic. First, there are DNA extraction and DNA analysis, fragment of analysis, DNA fragment analysis, by the good and strong library preparation, and for step 4 by amplification, and put it sample or put it the fragment DNA in the Illumina sequencer and analyze with the specific logiciel and bioinformatic analysis. This slide is prepared and analyze the last flowchart. There is 3 processing: pre-processing and assembling and bioinformatic analysis, and post-processing and analysis and interpretation of results. In the pre-processing, data, simulation, and correct error, of course, you must have or you should preserve the sample under appropriate condition to maintain the DNA. Then you extraction DNA and sequencing DNA and high throughput sequencing in the Illumina MySeq shotgun. Then you assembly and bioinformatic analysis was to use assembling, annotation, taxonomy analysis, and functional analysis. And the post-processing analysis and interpretation of a result, that the visualization the result of often presenting in the form of graph, in table or network to facilitate interpretation, or statistically analyze and conduct to the compare the difference in the sample and identify the microorganism present in the sample. Then the slide after explain the flow chart of processing sample metagenomic. First, there are DNA extraction and DNA analysis, fragment of analysis, DNA fragment analysis, by the good and strong library preparation, and for step 4 by amplification, and put it sample or put it the fragment DNA in the Illumina sequencer and analyze with the specific logiciel and bioinformatic analysis. This slide shows the figure of phylogenetic tree of bacteria species of microorganisms detected in the intraoperative peeling puree via microgen analysis or metagenomic analysis. This figure is a phylogenetic tree which shows the evolutionary relationship between the different bacteria species found in the patient urine gerd sample and representing a specific bacteria sequence identified. Then I try to compare it in my research the difference of tools to explore and investigate microorganisms in this sample and this reaches affection. The question: who is the best for exploration or for diagnosis and have more detection? It's clear that direct metagenomic peeling puree of this sample detect more than other tools like post-physical and culture fragment of stone. Why? Because you have a lot of species of anaerobic bacteria, fragilis, and a lot of species. And then you can interpret all of them with epidemiologic and clinical disease. And the second figure is a graphic representative of taxa of metagenomic in urine sample. This figure is 3D scatter plot that visually represent of the different type of microorganisms found in urine sample through metagenomic. Like in the red color, we show that bacteria is a strong microorganism and the high number of this microorganism. And the plot show separating cluster for different kingdom of life, including bacteria in red, archaea, fungi, plant, protista, and metazoa, based on the number of data points of each category. This visualization provides a clear overview of the overall microbial ecosystem of this patient urinary tract and confirm that the bacteria with 601 microorganisms were the dominant group found in this analysis. And finally, my conclusion and my take-home message is that our experience highlights the need to reconsider the role of anaerobic and emerging pathogen in complicated urethritis in children and our patients. We propose a multi-center genomic study of the urine microbiota in patients with urinalysis that will help clearly the etiology of this public health issue and improve patient management, access in the rapid medical management, and our goal to prevent the big problem of dissemination of multi-resistance microorganisms. And of course, you must always correlate the genomic results with clinical and epidemiological context. And thank you very much for your hearing, and see you soon.